A very beautiful morning to you out there, wherever you are listening to your darling station, IKD 106.1 FM. And today is the day for Health Talks. Today is the day on the issues where we discuss everything about health, talking about the health sector, talking about taking care of yourself, talking about the community, how to take care of the community, and everything that has to do with health generally. Welcome to the issues on IKD 106.1 FM. My name is Gift Ogbona, and today on the issues we shall be discussing everything about antenatal care. Yes, today is the day to talk about increasing maternal mortality rates on antenatal care. And we have a nurse who is already in the studio with us, and together we shall be dissecting the topic. She will give us a brief introduction about the topic and also enlighten us when it comes to antenatal care. There has been an increasing maternal mortality rate, and it has been something that one has to address and also talk about. Yes, women need to know how to take care of themselves and how to take care of the body when they're pregnant, and even postnatal care. Everything that you need to know about antenatal care is what we're going to be discussing today on the issues with our nurse. After this quick breather, stay tuned. Be right back. Welcome back. It's still the issues on IKD 106.1 FM, where we discuss critical matters about our community, state, and the country. And today is all about health talks, talking about health situation. And a topic for today is on antenatal care. Yes, the increased maternal mortality rate is what we're going to be discussing today. And we have now Miss Inacia. She is the Director of Nurse Service, the Assistant Director Nurses Service, and also the Head of Department Antenatal Clinic in General Hospital, and person of Abiola Adetokunbo. Good morning, and good to have you in the show today.
Good morning. Thank you for having me.
Yes, Abiola, you are highly welcome to the issues today. So let's get straight to the business for today, talking about health care. There has been increasing rate when it comes to the maternal mortality rate, and also that's why you're here today to talk about antenatal care. So let's start first. And first, what is antenatal care?
Well, antenatal care is, we call it prenatal care also. Okay. That means before the woman puts the bed to bed. So it's given to a pregnant woman to monitor her and the child that is in utero. You know, she comes for a regular checkup where informations are provided concerning the mother and the child. Even during antenatal care, the woman is also prepared for postnatal care. Okay. You understand? And antenatal care, it's also a place where emergencies or complications are seen early and they are quite treated. So every pregnant woman should undergo antenatal care, because that is the only place the mother and the child can be cared for. And you know, and we usually lead to a safe delivery if all things are being obeyed.
Okay, when we're talking about antenatal care, women attending the antenatal care, when is the right stage for a woman to attend antenatal care? Or when is it right for a woman to know that she needs to attend antenatal care?
The moment the woman notices she's pregnant, she did a pregnancy test and is positive. So within the first 12 weeks, she's expected to have come to register, okay, which is the first trimester, you know, and from there she will be monitored until she puts to bed. Okay. So from the first trimester, latest by 12 weeks. It could be earlier, but latest by 12 weeks.
Okay, talking about the postnatal care you did said, antenatal care comes after the postnatal care. So when a woman is pregnant, she attends the whole antenatal care, and then there is postnatal care. Can you tell us what is it all about?
No, postnatal care comes in after the delivery, when the woman has put to bed. Okay. So we give appointment also to make sure all things are well with her and the child before she is discharged. Okay. You know, usually we don't discharge the patient until after 6 weeks of delivery. When we assume the uterus would have gone back to its pre-pregnancy state, the lochia would have stopped coming. It's just to ascertain she does not have any infection, she's not septic, she's not anemic, you understand. For the PIH mothers also, we give frequent appointments to monitor their blood pressure. And if it's not going down, a proper referral will be made to another department. That's the medical department, who takes up the care of such woman who is having high blood pressure. So postnatal care doesn't just stop after 6 weeks, depending on the condition of that woman.
Okay, so how important is postnatal care? Because some women, you see them out there after the antenatal care, they give birth, and that is it. So how important is postnatal?
Of course, postnatal care is very, very important as that of the antenatal care. We've seen women who have gone home and they rush them back, or those who have delivered somewhere, by the time they come in, you find out that they are anemic, they don't have enough blood, and they are breastfeeding. Of course, because they share their nutrients with that of the baby.
Okay.
So it's not enough. Such a woman will go down. But if she has attended antenatal care, of course, such condition would have been arrested on time and intervention would have been given. For some of them that goes home also, they come back and they look septic. That means they've had infection. And they will be treated for such cases before it becomes a blow-up problem for them. So postnatal care is also important as antenatal care.
Okay. Maternal mortality rate. Can you enlighten us more on that?
Yes, that is a global problem. You find out that all over the world, the maternal mortality rate is still increasing. The statistics as of 2020, if I'm correct, WHO said of every 100 births, we have about 997 women dying. That's a lot. And when you come down to Nigeria, of every 100 births, 2020 statistics says we have about 1,047 women die. Now when you come to Lagos State, we still have 555 women dying of every 100 births. That means it's a problem. It's still alarming. We need to do more. We need to do more as individuals. We need to do more as a community. We need to do more, as our government.
Okay, you said that there has been an increased rate. What would you say is really the problem?
Well, most times, most women don't attend antenatal care.
Okay.
That's the first one. The second one is, even if they will, they come in very late. You see some women, they come in at third trimester, less than 3 weeks to go. You have little thing you can do. Then we have a lot of unskilled birth attendants. That's where the problem lies.
Okay.
They are not trained. If trained, not properly trained.
Okay.
And if trained by the government, they are not doing the ideal. They are not limiting themselves to the boundaries because the government has told them when to raise alarm and when to send patients. But you find out that most women still stay with them 48 hours in labor. And by the time they will bring them down to the secondary facility, it's late. There's hardly anything you can do to help. So the problem still lies more with our unskilled birth attendants.
Okay.
If you go down the history, you will know that all women are midwives.
Okay.
Some still believe that every woman can still take childbirths. No, you must be trained. You must be trained to know when there is emergency and when to refer. You must be trained to know how many hours a woman should be in labor, when there should be an intervention. You just don't keep the woman with you and say, of course, I'm a woman, I've given birth. We still have some women who gives birth at home. They say because they gave birth to the first child, the second child, the third one, they still stay inside their womb and they give birth. And problem will arise. Some will deliver and begin to bleed. And will not even say anything until it is late. And they will bring them there to the hospital. So we have a lot of problems. We have unsafe abortions. You understand? We have women not embracing family planning.
Okay.
You've just given birth to a child. It's not up to 2 years. You are getting pregnant. You are at risk. Because you've not rested from the stress. Pregnancy is a stress.
Okay.
So you've not gotten over the stress of the first child. You are getting pregnant the second child. You understand? Then we have obstetrical complications.
Okay.
That if it happens where there are no skilled hands, such women will not make it. Some could be detected even while she's still pregnant.
Okay.
But depending on where she has registered. And if not detected, she goes into labor, it will be an emergency and she may lose her life.
Okay.
We've seen some women come with head of the baby off and the body is inside. You understand?
Yes.
So we have a lot of cases that are still increasing the maternal mortality rates in Lagos State all over the world.
All right. You did mention about birth attendants, unskilled birth attendants. How, or rather, in what way will these birth attendants be trained? If at all they're unskilled, that means there is a problem. Then how will they be trained? And of course, is there any regularization when it comes to these birth attendants? Maybe the government regularizing them. Maybe they have a vocational kind of training or a certificate before you go into midwifery, or even have that tendency or have the right to deliver a baby.
Yes, I don't know about other states, but I know that of Lagos State that, the trained birth attendants, after they've been trained somewhere, maybe for some years, I don't know, but the government still mandates them to come to a secondary facility where they watch and see how delivery is being done. You understand? The standard where they watch. And when it is not going the right way, I know there is a regulatory body that tells them to refer immediately to a secondary facility where such patients will be accepted from them. But the way we are in Nigeria, I don't know. We do things until we are caught. You understand? We do things and we go scot-free until the hand of the government catch up with us. So we find out that most of them don't follow these rules that were given to them. A lot of them, the government send them to secondary facility to know the right thing and know when to send in patients. But they still hold on to these patients until it is late.
Okay, so going forward, what way do you think that the government or this regulatory body can implement rules and regulation guiding these birth attendants? So going forward, there will be no cases like emergency when it comes to child delivery.
Well, I would say we have the primary health care centers, which is the grassroots and very close to the people. So I like I said that every woman should take her life in her hands. Don't just entrust your life into the hands of just anybody. If you cannot meet up with the secondary facility or the tertiary institution, we have the primary health care center, which is the grassroots. Go there, you'll be attended to. You understand? And every woman should bear it in mind that pregnancy is a risk. Maybe when we know that pregnancy is a risk, you don't know the outcome until you deliver. So you prepare for the outcome. You just don't assume all will be well. So let them start from the primary health care center. Because when they get to the primary health care center, of course, they do the normal thing. When they know, okay, you are not a case for the primary health care center, such women are referred to the secondary facility where they can be taken care of. For example, a woman who had had a cesarean section for once, they don't even take. Then there are some, when they see your height, they know, of course, you'll not be a good candidate for a vaginal delivery, so they make a referral. Or by the time you do a scan, they see the position of the baby. They don't know this woman is not fit for a vaginal delivery. Those are the things we'll do to reduce maternal mortality rates. Now, for this skilled or trained attendants, the birth attendants, the government should still enforce. Maybe when they have dogs that goes round and anything goes wrong in all of these faith homes, and they sanction them, they will sit up. You don't keep a patient because you want to collect money for delivery and you don't make a referral. A life is involved. Sometimes it's more than 2-3 lives that are involved. So the monetary aspect is one of the problems we have with the skilled birth attendants that don't make them to release patients on time.
All right, so moving forward, how can this increasing rate of maternal mortality be prevented?
Yes, like I said that if we want to reduce maternal mortality rates, women should seek antenatal care first. The second thing is women should know that their life lies in their hands. 3, they should go for family planning. 4, they should not get engaged with unsafe abortions. You understand? 5, also, they should seek the help of skilled, trained birth attendants. And when there are complications, they should seek the help of qualified obstetricians.
All right, you did mention about family planning, and we know in Nigeria, in some of these communities, mostly the rural communities, most women there does not even believe in anything that has to do with family planning. So what advice will you give to women? How do you enlighten them to take their life seriously, like you said, and start planning or get themselves engaged in this family planning, as you said?
We just need to keep talking about it. We make advocacy about family planning, It's getting better because of the economical issues. People are coming. Before I left the facility this morning, we've had over 35 patients coming in for family planning. Family planning does not mean you can't have the number of children you want. But just saying that space there.
Okay.
Recover from the last one. Get yourself healthy. Prepare. You just don't get pregnant by chance.
Okay.
You get pregnant by being prepared. You're sure you are ready to be pregnant. And your health can carry that pregnancy. Then go ahead. So that's what family planning is saying. It's not saying when you come, stop having babies. No.
Okay.
It's just saying space your
delivery.
Yes, just space your delivery. At least 2 years. You would have recovered from the previous one you've had. So family planning is everywhere. You can be attended to at primary health care center. It's available there. It's available at the secondary level. It's available at the tertiary level. So we have family planning and it is free. It's free. And the commodities are available.
Okay.
So women should embrace it. And a lot of rumors they carry about family planning. But the funny thing is when they come, you ask them, okay, you said this, which one have you done? And you find out, no, it wasn't me, it was my sister, it was a cousin, it was and you just try, and you tell them there are methods. If you use this, it's not good with you, you use the other one.
Okay.
So you can't take away family planning from safe delivery. Because if you have one less than a year, you are at risk of developing complication. And part of what causes problem is postpartum hemorrhage or antepartum. Those are part of the things that increase maternal mortality rate. Infection. Like I said earlier, some of them, they have sepsis because where they deliver is not hygienic. So they develop sepsis. And infection do kill during postnatal. And you find the woman dying.
At the rural areas, talking about the grassroots level, there are some women who believe in the traditional way of giving birth. Some will tell you that they don't go to the hospital. They have their own midwives. They are doing their family business. That is just a tradition within them. What will you say about this?
So you can't take away tradition from us. Culture is still a thing you can't take away. Our norms are there. So we can't take them away. But they must be trained. They must be trained. And that's why I said they must be trained, skilled birth attendant. Skilled means they understand the rudiment of delivery. They know when it's going.
When there's complication.
It's moving away from the normal. And they need to seek help. So those are the ones that are skilled. Not just being trained. Skilled. Trained and being skilled.
Okay. All right. So you also did talk about postpartum, and I've heard cases where women are having postpartum depression, and it's one of the problems you just said. So how, going forward, first of all, tell us what this postpartum is all about before we move to women having postpartum depression.
Postpartum is 6 weeks, between immediately after delivery to about 6 weeks. That's postpartum. That's after delivery. Within that 6 weeks of delivery, that's postpartum. And such women also, we have women who have the tendency of having postpartum blues. That's what we call it. It's just a kind of an emotional breakdown. Some can't stand the stress of delivery. Some can't stand the stress of childbirth. Some can't stand the stress of caring for a child.
Okay.
Anxiety mood also comes in. Some become so anxious. And it does, sometimes it's not until they deliver, but you can start seeing the sign even while they are attending antenatal care.
Okay.
That this individual may come down with puerperal blues. You understand? Some already have mental issues.
Oh,
And
okay.
you understand, before pregnancy.
Okay.
And that's why I said antenatal care is very important.
Okay.
Because such women would have been seen by psychiatrists, psychology, and would have prepared her for delivery and care for the baby.
Okay, all right. Talking about the community and the government, what role has been put in place, or what measures can be put in place to make sure that there's a decrease when it comes to maternal mortality rates?
Well, the community, especially the primary health care center, should do advocacy visit to the market women. Not only them, even the secondary facility also can do that. Make an advocacy visit to NGOs, market women, faith homes, in our churches and in the mosques. We can do that. We can encourage women to seek delivery from the right source. Tell them the complication they can get involved in. We had a patient sometime in one of the general hospitals where I worked. I think she came in with a 6th child, and the nurses were telling her, "Oh, madam, you are coming with a 6th child. Go for family." But she said no, that in their village they usually have 9. By the time she will come with the 7th one, she has not even fallen into labor. They brought her dead with the 7th child. So we need to do a lot of advocacy visits, talk to our women, not just our women, involve their husbands. Because some of our men, they will say, "Look, I'm the only child of my mother. So I'm going to have all the children my mother couldn't have, and I will add them to my room." No. It's not all about I can cater for them, I have the economical power. No. The health risks involved should be considered. So when we talk to the women, we talk to the men. We carry everyone along. Even I want to encourage our men to visit the antenatal clinic with their wives, so that the woman will receive support. In Nigeria, women don't receive support, and also leads to that puerperal blues. When there is no support, she's left alone. You understand? We need support for our women during pregnancy and after pregnancy. So I will encourage our men to visit the antenatal clinic with their wives. And for the custom, anyone who is to take delivery should be trained and skilled. If not, the hand of law should catch up with them.
Okay, all right. Let's debate a bit. When it comes to female mortality, genital mutilation in Nigeria, and also with this rate of maternal mortality rate, the increase, is there any...
Yes, of course, you are very right.
Okay.
You understand? There is, if the clitoris has been chopped off, there will be scarring.
Okay.
And that area ought to be an elastic area that when the head of the baby is coming, it should give way. It should expand and increase. But this time around, we've cut it off. And it has formed a scar. So there is no way to expand. And sometimes, so when the head of the baby is coming, it can just cut through from the vagina to the rectum. And you have the woman having VVF.
VVF.
Yes. So we have some cases like that. So it's part of it. The ones that don't have, we start bleeding. We have postpartum hemorrhage. And a normal woman who has given birth, naturally wouldn't have needed blood transfusion. We need to be transfused because she would have bled more than normal. And the place needs to be resutured. So the clitoris also is not just a sex organ, it's also part of the delivery organ.
Okay.
That aids in delivery.
Okay, all right.
So the government is against women being cut. No.
Okay.
So we are against genital mutilation.
All right. This is still the issues on IKD 106.1 FM, and today is all about health talk. We're talking about antenatal care. the increase of maternal mortality rate with our nurse, who is also the head of Department of Antenatal Clinic, General Hospital, and also the Assistant Director, Nurse Abiola Adetokunbo. She's in the studio, and together we're dissecting everything that you need to know about antenatal care, how women should take good care of themselves when giving birth, when pregnant, when giving birth, and even after giving birth. So you can also be part of this conversation if you ask any question for nurses in the studio. You can do well to call in on 09040821061 or 09040811061. She'll be here to attend to your questions, anything that you think is bothering you or you need to know or get yourself educated or enlightened. Call us on 09040821061 or 0904081 1061. So back to you, Nurse Abiola. Still on the female genital mutilation in Nigeria. There are some parts of Nigeria who, or some parts of Nigerian community who does not even believe in this female mortality genital mutilation. They keep on practicing it, and it's a norm to them. And even with the whole advocacy and campaign, media campaign, enlightening them, there are still some cases whereby they still believe that if that woman is not caught, she will become promiscuous. What do you have to say about that?
We'll keep talking to them. You understand? Change is difficult. Okay. And we hold our custom in high esteem. So we still need to continue to talk. And that's where the women advocacy, organization also comes in. They need to continue to talk. I know some parts in Nigeria that still get involved. But I want to tell you, it has drastically reduced. Not like when we are growing. It's not like that. Okay. So, and I believe that with much talk, with examples, physical examples, they've seen happening to their own children. Most women don't allow them. Because even apart from childbirth, when they do for these children to sepsis, some bled, and they need to be rushed to the hospital, be transfused, need to resuture. A lot of things happen. It's because they don't see it. But when you see the damages, I don't know the correlation between the clitoris and being promiscuous anyway, but I think it's a thing of norms that we believe.
Just a notion.
It's just a notion.
Okay.
I don't know the correlation.
All right. When it comes to this case of the increasing maternal mortality rate in Nigeria, what do you think the community can do to make sure that women at the grassroots level get the education they need about this maternal mortality rate, to know that there is a problem, and going forward this is the way you should go to solve the problem?
Thank you, presenter. I would like to beg all our women out there that please, before you get involved or you get engaged in taking delivery, make sure you are competent. If you are not, don't. Remember, it's somebody's child, somebody's daughter, somebody's wife, probably somebody's mother. That life is important. And for all our women, I want to beg you, please, don't take delivery by yourself at all. You need someone to be with you, a birth attendant, who will assist you in delivery. Then to all the community members, if you see a pregnant woman, in your residence, in your community, it's not out of place. So if you are close to that individual, to ask where they have registered. They can start their registration from the primary health care. And the primary health care knows the ideal to be done. Please let every woman be involved. Let the grandmother, let the sisters, the brothers, the husbands be involved. We need to reduce maternal mortality rate in Lagos, in Nigeria, all over the world.
Okay, all right. The phone lines are still open for you to call in if you have any questions. For Nurse Abiola from the General Hospital Ikorodu, you can do well to call us on 09040821061 or 09040811061, 09040821061 or 09040811061. 1061. Let's deviate to the health sector in general. There are some cases where you see some midwiferys in this rural area complain that they don't have enough facilities, they don't have enough techniques for them to deliver babies. What will you also say about that? What's your reaction?
I don't know the equipment they need in the rural areas that will not be available. You understand? I know they will have the episiotomy scissors. They will have sutures. They have their hands. They will have gloves. You understand? To take delivery. And they have beds to put the women.
Some of them actually even do complain about the distance from bringing a woman from a hospital, from her home down to the hospital when it comes to transportation. Some even go as far as even complaining that these women don't even make it on time to get to them before delivery.
Well, if it is primary health care center, I believe every community, every local government have one.
Okay.
In Ikorodu, we should have more than 7. So there should be one that's less than an hour you can get to.
Okay.
So that woman should register to the closest one.
Okay.
You understand? And if the woman is using a secondary facility that is a bit far away from the home, labor don't start and you deliver immediately. It would have, you know, if you have delivered before anyway, you know how many hours you use in labor. If it's those ones that you know is precipitate labor, I will advise you to have second option. That in case if I can't make it to the hospital, is there a primary health care center very close to me? Those are for those women with vaginal deliveries. But for other women that have other mode of deliveries, of course we would have put them on the bed before the time of delivery. So there is nothing like an emergency transport. Now for the PHC, that sometimes they complain that they don't get transportation to bring their women down. I prepare the mind of my patients during antenatal. It's part of their talk. That look, if your husband has a car, please make sure the fuel tank is not empty in case you fall into labor. Now, if your husband doesn't stay with you, make sure you have identified a neighbor that you are close to, you talk with, you prepare his heart and that of the wife, that anytime you fall into labor, they will bring you down to the hospital. Now, if you don't have any of this, get somebody who has what do you do? Tricycle, keke napep. Yes. To get somebody that you can talk to and say, look, if I fall into labor, I'm going to call you anytime. You just bring me to the hospital. That's part of preparation. You just don't assume when I fall into labor, I want to come. Then we'll prepare them also that, look, in case you know there is nobody staying with you and you have other kids, get somebody to start staying with you when you are 8 months plus, so that when you fall into labor, you will not be thinking of where to put your children. Those things, Africans, we don't do it, but they are part of preparation for labor, so that you don't deliver at home, where you start looking for solution. At the time you should be moving to the hospital.
Okay, all right. Let me put you to this. When it comes to cesarean section, the CS, there are still some parts of the country, some parts of Nigeria, who does not even believe anything that is called CS. Some will even tell you, I don't want my wife to deliver through CS. I don't want anything like cesarean section. I want a normal birth. Please educate us on this.
Well, that's another problem in this part of the world. And I would say that's just being ignorance. Because any woman that is pregnant should always have a way of delivery. That child must come out. And we should bear it in mind that we just don't want the child to come out. We want a child that will be alive. We want a child that will be viable. We want a child that whose mental health will be correct. You understand? So for the obstetrician to offer a cesarean operation, that means there are some conditions surrounding the pregnancy that will not allow the woman to have a vaginal delivery. And they just don't tell them you are going to have a cesarean operation. The nurses talk to them about it. The obstetrician sees them, talk to them about it. You understand? They encourage them, tell them. And most of these women who reject it, they come back as emergency They still have it because those conditions cannot make you have your child vaginally. So every woman should bear it in mind when she's getting pregnant. That it's either I have a vaginal delivery or I have a cesarean delivery. But whichever delivery I want to have, I should have a live child, want a live child and a live mother.
Okay, so it is normal going forward that a woman can deliver with CS. It's not a problem whether
it is not
through the vagina or through it is not a problem.
It is not a problem.
Okay, all right. There have also been instance cases of abortion in Nigeria, which is also. But let me ask you this question: when it comes to a woman who has birthed or have a child through CS, does it has anything to do with this maternal mortality rate in Nigeria, or also the abortion, like you said, because you did mention abortion, that is also part of it. When a woman keeps having abortion, so enlighten us on this part when it comes to the abortion. And also, does this has anything to do with CS?
No. They are two different things. Abortion is just that you don't want that pregnancy. The pregnancy you've not desired, you don't want, or you are not ready for. So you want to get it out.
Okay.
So that's an abortion. There, we call it self-termination. That you decide to terminate on your own. Not for medical reason. We have some medical reasons that the obstetrician will say, look, if we keep this pregnancy, your life is at risk.
Okay.
That's for medical reason. But for self-terminations, you need, instead of committing abortion that will lead to, hemorrhage, leads to sepsis, damage uterus, which can cause infertility later in the future.
Okay.
I will advise every woman who is not ready to nurse a child to do a family plan.
Okay,
we have the short term and we have the long term family.
Okay. For a woman who has engaged herself with this abortion, does she have any chances of having any maternal mortality problems?
Depending on how many she has had.
Okay.
Everything that she does is from the uterus, which you call the womb. So depending on how many pregnancies she has aborted, it could not really lead to her death, but depending if she has sepsis with it or she begins to bleed with it there. But if she's able to escape it, get pregnant again, she may have other complications because of that, which she may come down with incompetent cervix, having several abortions when she needed those children. They may not stay. But there are things that can also be done for such women medically to keep the pregnancy. But instead of getting involved or getting engaged in abortion, I will advise every woman who is not ready to nurse a child to do a family planning.
Okay, so is it safe to ask this question? You did mention that what can be done. Is it safe to ask you what can be done for women who might have been having this problem or facing these challenges but don't know how to speak to someone?
Such women should visit the gynecology clinic and they will be attended to.
All right, and in the case of the cesarean section, as I said, does it have anything to do with the maternal mortality rate?
It reduces it.
Okay.
Instead of increasing it. Of course, instead of allowing the woman to fall into a normal labor, have a vaginal delivery, come down with the complications that would have been avoided. Of course, the cesarean section has taken care of that complication. Okay. So it reduces maternal mortality. And in our environment, most women still run away from it.
Okay, but is there any problem when it comes to why women are running away from it?
When women just believe, look, my mother delivered me normally, I should deliver my child normally. But they are not their mothers. So many conditions will make a woman not to deliver normally. You can't tell me when you are so short, and without will actually tell me how your pelvic area will look like. So if you fall into labor, how will the child pass through a very small pelvis?
So you're telling me that this thing has to do with both even the height when it comes to a woman?
Not even only the height. Okay. Even the woman can fall into labor and the cervix may not heal The service may not dilate. The service may refuse to. So such woman, that child needs to come out. Women who have high blood pressure, will you allow them to go into a normal delivery? Of course, during labor pain, the blood pressure will increase and another complication will set in, and you may eventually lose the woman and the child. You understand? So there are so many things that are considered before options for deliveries are given.
Okay, all right. Going forward, first thing first, let's get your advice to the government when it comes to more advocacy on the maternal mortality rate, and also when it comes to the women, more advocacy on needs, and even when it comes to the men and community as a whole.
Like I said earlier on, that let me start from the community, that we should be our neighbor's keeper. If you have a pregnant woman close to you, it's not out of place to ask, where did you register? And give the appropriate advice. Okay, if you can't make it to the secondary facility because it's far away from you, can you just visit the primary health care, which is very close to the community? Then, number 2, the husband should be involved. The husband should visit the clinic with the wife and see if how the outcome of delivery will be. Because some men who are interested in their wives and they come to the clinic with them, by the time you offer them options for delivery, we don't have issues. But the ones that stay back at home, will be commanding the woman to come home. So the men should be more involved. They should create time. They should see themselves also carrying that pregnancy. That, look, I have antenatal care visits in the next 2 weeks. So they should come with their wife. You understand? Thank God for the government. They now take paternity leave. And so where is their paternity care? Their paternity care starts from antenatal. The government is giving them time to rest because of all the stress they've done doing antenatal. So any man who does not go to the antenatal clinic with wife should not have paternity leave. Are we together?
Yes.
So they take paternity leave. They should be part of the antenatal care. Now, to come down to the government, the government are doing more, but they should, they should intensify. Bring to books those unskillful birth attendants that takes life at will. The teenager's pregnancy is part of the problem that increases maternal mortality rates. Because if they are less than 15, of course, there will be problem doing childbirth. Even some after 15, they still come down with problem. But what I will say is, if we find any teenager that is pregnant, it's not time to start, saying things that will make such teenager wants to commit suicide. It's time to just support, care. You understand? Part of support is to register such a teenager in a secondary or tertiary institution, a facility, where they have all the equipment on ground to save and to assist in delivery. Then, part of support is to offer such teenager family planning. Please don't shy away from it, parents at home. Any child that is sexually exposed cannot stay away from sex. The only thing you can do is to prevent pregnancy. So such teenagers should be, taken to the family planning clinic to obtain a method. So that whatsoever she decides to do with her life, she will be able to complete it well and not be a burden to the society.
Okay, our time of actually is fast spent, but let me leave you with this. Let this be your party word when it comes to NGOs in Nigeria. What's your advice also for them? Because there are a lot of NGOs who take care of women when it comes to antenatal, who take care of all these teenage pregnancies and the likes. What will you also say about
that? They are really working. Like I can't remember the name of the NGO right now, but I know one works with the primary health care in Talewa. With girls who are teenagers and they get pregnant. They bring them, they register them, they get them baby things. I think they care for them for some few months. They even give to them vocations. You know, I want them to do more. Not only the teenagers, even some of our women, they are not financially empowered. Their husband has more than 1, 2 wives, and they will need assistance. So if we find those ones also in the community, they should be assisted. Because some reasons why they visit this, I don't want to use an English word that's not palatable, the untrained, unskilled ones, is because they will tell you they are not financially buoyant. But if we have NGOs who can help such women, you understand, then we need NGOs also who will continue to talk to our women who already have 4, 5 and still want more, that they are at risk. Then coupled with age also, pregnancy comes with age. So when women are getting pregnant, they should consider their age. If you're a woman who are over 30, please don't go to any skill birth attendant to take your delivery. Don't go to primary health care center. You can visit the secondary facility and the tertiary facility for your delivery, so that you know you are in a safe hands.
Okay, all right. Let me leave you with this. Going forward, there might be women who would want to have personal questions or get enlightened personal. Can they reach out to you in General Hospital Ikorodu?
Ikorodu, yes.
Okay, so it is advisable that any woman who has personal questions or anything that has to do with antenatal care or have a problem can easily reach out to you.
Yes, it's just in this part of the world we don't have a clinic before you get pregnant. Pre-pregnancy clinic, you understand? They prepare the woman to be pregnant. So in such clinic, so many questions
will be attended
to and would have been resolved. By the time that woman is pregnant to the time of delivery, the health worker will have less job to do.
All right, you heard from our nurse Abiola Adetokunbo. She's the head of department at antenatal care in Ikorodu General Hospital. If you have any personal questions, you have anything bothering you, or you want to address the situation when it comes to pregnancy, delivery, childbirth, postpartum, and the likes, please do well to reach out to the Department of Antenatal Clinic, General Hospital Ikorodu. And this is where we actually put a full stop to the issues for today, but the issues continues tomorrow. Our time is fast spent. So sorry that we can't take calls coming in now because the time is fast spent. But do well to join us tomorrow for the issues same time. And of course, stay tuned for other interesting, educative, and informative program coming up shortly. My name is Gift Ubona. It's a bye for now.